Everyone's good? Well, good afternoon, everyone. My name is Matt DeCamp, and I'm an associate professor here at the Center for Bioethics and Humanities. And let me welcome all of you to the Gossard Forum in the Fulgenetti Pavilion for today's event. Before we get started, I do want to acknowledge the co-sponsor of this event, which is the Center for Interprofessional Practice and Education. Today's talk joins the One Book, One Campus initiative, now in its 7th year, which brings together all students and faculty on campus around an important contemporary topic in healthcare. This year's topic is One Health, and the book selection is What the Eyes Don't See by Mona Hanna-Attisha. And there are multiple events planned around campus around One Health this year, and I encourage you to find those on the One Book, One Campus homepage. Lots of other important events. The idea of One Health is near to my heart. The interconnectedness of people, animals, and places plays an increasingly prominent role in our understanding of human rights and justice. From the level of global climate change all the way down to the exam room, it seems we need to take this topic seriously right now, else I suspect we'll have no choice later. Before I move on, a reminder for those online, please be sure you're muted and use the chat feature for questions, which will be moderated by Malia Himber. Let me also thank David Weil in the corner, the maestro of the forum, for today's technology setup. So for today's topic and speaker, Dr. Hope Ferdowsian is professor of medicine at the University of New Mexico School of Medicine and president of the Phoenix Zones Initiative, a global nonprofit that uses medical and public health expertise to advance the health and well-being of people, animals, and the planet. Raised on a farm in Oklahoma by parents who were human rights activists, Dr. Ferdowsian has over 2 decades of experience as an internal medicine physician, in preventive medicine as a public health physician as well. She has cared for individuals who have experienced displacement and violence and worked on policies to address human, animal, and environmental exploitation. Her work across 6 continents has included consultative support for national as well as intergovernmental policymakers. She's also the author of Phoenix Zones, Where Strength is Born and Resilience Live. The book draws on the analogy of the mythical phoenix rising from the ashes to show how individuals too can rise from the ashes, not just on their own, but because of the obligations we have as a society and a community to create the structures for their doing so. Please join me in welcoming Dr. Hope Ferdowsian.
Thank you, Dr. DeCamp. It's really great to be with you all today. I'm really grateful to be here, and I look forward to talking with you all more after I share some of my thoughts and observations. But before we get started, I just want to offer a big thank you to the Bioethics and Humanities, Professional Practice and Education project in partnership. This is such an incredible group of individuals. I've already come to know such talent and capacity that's been offered, and so I really appreciate it. I also just wanted to offer a little bit more background, drawing on what Dr. DeCamp said, so that you maybe have a better understanding of the framework for some of the thoughts and observations that I'm going to share. Over the past 20 years, I've had the opportunity to work around the globe, and there isn't a day that really goes by that I don't think about those individuals that I've had the privilege of coming to know, whether that's sexual violence survivors or torture survivors in conflict zones or seeking asylum here in the United States, or families, mothers who are trying to provide food for their children and get the health care they need, HIV care, for example, so that they can be alive to take care of their children, or the individuals experiencing homelessness in like New York and Washington, D.C. I've had the tremendous privilege of getting to know and care for over the years. And I don't just think about their suffering, but I also think about their capacity for resilience when they are given the chance. And over the past 20 years, I've also had the opportunity to work on matters of animal protection, During that time, I've also come to care about issues that affect animals and to be concerned about their plight as a result of their marginalization in society. And these aren't the same types of marginalization, but they certainly have some of the same roots. And so as a result, I spend a fair amount of my time thinking about how we address the roots of problems that ail us as a society in a way that does justice to those individuals, to families, communities, and the society that we live in are obligated to, as Dr. DeCamp said. So with that, I think it's worth starting with a key question, and that is, what ails us? Generous enough to give me a tour of the exhibit here. And if you all haven't done that yet, it's try. We're going to talk about a new era for healthcare. It's worth starting with this central question: what ails us as individuals, sometimes our patients, as families, as communities, and as a society? Well, in medicine, public health, and research, we often answer this question in categories: non-communicable disease, communicable disease, physical disorders, mental disorders. And we also think in terms of organ systems, right? And how those organ systems work together. But too rarely do we actually consider bigger systems, including systems of justice and systems of power, and how they affect health and well-being. We're going to talk about what ails us. We also have to talk about broader existential threats, more and more important to us in medicine, public health, and research, whether we're talking about pandemics or climate change or pollution or hunger or violence or conflict. And it's worth pointing out that vulnerable and marginalized populations are the most susceptible to these threats, even though they have generally contributed the least problems. Part of the reason for that disparity is because there are determinants of health, or what we understand as determinants of health. Social determinants of health, for example, nutritious food, access to safe housing; economic determinants of health, the opportunity to learn and to work; environmental determinants of health, like climate stability and pollution, or how clean our environments are; legal determinants of health, the laws and policies that ultimately determine social, economic, and environmental determinants of health; and political determinants of health that I don't think we talk nearly enough about, that ultimately determine what our priorities are in terms of getting laws and policies passed to address social, environmental, and economic determinants of health. Late physician and anthropologist Dr. Paul Farmer wrote about these issues extensively in his book, Pathologies of Power. And there he articulated how pathologies of power ultimately influence structural violence. And structural violence can include problematic societal norms, economic frameworks, laws, and priorities that reinforce historical and modern injustices like racism, other isms. Public health structural violence explains many of the disparities we see, for example, in terms of morbidity and mortality rates among. And this broad framework of pathologies of power and structural violence and determinants of health can help us understand better how justice helps determine health. But what is justice? We talk a lot about justice, but we rarely define it. Well, one of the more prolific writers on social justice is John Rawls, and he articulated justice as fairness. And he articulated key principles of justice, particularly the principle of liberty. Also, that the most vulnerable members of society should receive the greatest protections and the greatest benefits. And that applies, of course, to when we're talking about research, medicine, and otherwise. And then other authors still have articulated justice in terms of rights. For example, how we recognize the rights of each other. Often recognize justice and injustice when we. I think one of the biggest examples of this most recently is that virus with a crown, the coronavirus pandemic. And that has really illustrated how pathologies of power, structural violence, and determinants of health really can play out in research, medicine, and public health. As a result of the pandemic, about 7 million human lives lost in terms of direct loss of life. Many more indirect or excess deaths have resulted from the pandemic. And we now see a strained healthcare system that we're still struggling with. We've seen delays in prevention and care, workforce shortages. People in medicine are leaving their chosen fields after years, partly due to demoralization related to the injustices that we've talked about. And all of these issues have had disproportionate effects on the most marginalized and vulnerable populations. Some have certainly suffered more than others. The pandemic has exacerbated inequities within and across nations. Deadly hotspots during the pandemic occurred at places like meatpacking plants, at farms, and other places where workers already had lack of access to basic rights. Millions of children have been orphaned. About 10 million plus children have lost a parent or a primary caregiver in the US and around the globe. In the US, it's about 1 million at this point. And there have been a number of educational setbacks. There are still schools that are closed in pockets of the globe. And there's been an increase in child exploitation, particularly in the area of child marriage and child labor. In the US, we've seen an increase in child labor, including in agricultural settings, some of the most dangerous places for children to work. And even though it's not reported on, there have been a number of deaths just in the past year. Also worth considering who's benefited the most from research and medicine and public health as a result of the pandemic. And largely, that's us, rather than other more vulnerable and marginalized populations. It isn't only humans who have suffered, particularly in labs and in farms around the globe, including here in the US. Animals have been killed en masse in particularly cruel ways as a result of concerns about outbreaks or shutdowns. The likely origins and evolution of the pandemic also are related to the treatment of non-human beings. The strongest evidence yet that an animal started the pandemic comes from genetic and epidemiological evidence that shows that a live animal market and a raccoon dog were really at the center of the pandemic. And that raccoon dog was likely in contact with other animals, including perhaps directly with bats, whose ecosystems were destroyed as a result of grazing and so forth. That shouldn't surprise us because about 3/4 of outbreaks stem from animals and the ways in which they're treated and the ways in which the broader environment is treated. But the nexus between the treatment of human and non-human beings and health and suffering of human and animal beings doesn't stop there. In fact, violence against animals is linked to child abuse as well as to community violence and societal violence. And there are some historians who have even linked the treatment of animals to human atrocities, which is a particular crime. The cruelty of industrial farming extends beyond that to include fueling through inefficient land, grain, and water use, also fueling the burden of chronic disease, including top killers like heart disease and cancer. Animal and environmental exploitation also drive air, water, and soil pollution, which causes more human deaths than HIV, TB, and malaria combined. The destruction of habitats, including the biggest carbon sinks, forests and oceans, drives climate change, which harms people and animals every day. So One Health is a framework that's been proposed to address the interconnected health of people, animals, and our shared environments. And it's an interdisciplinary approach, as most of you know, that aims to sustainably balance the health of humans, other animals, and our shared ecosystems. Old idea that's gained traction over time, and in fact, ancient and indigenous traditional knowledge underlie One Health. And One Health really only made its way to medicine, in part as One Medicine, by physician pathologist Rudolf Virchow, as well as others who articulated that there's no clear dividing line between human and One Health became more popular in the early aughts when concern for great apes in their native habitats, they were interfacing with humans and human viruses and dying. Conservationists became interested in health. And then by 2003, a novel coronavirus, this time SARS-CoV-1, which caused SARS, was also known to have emerged from animals and been transferred. Today, of course, the COVID-19 pandemic has. But something's missing in One Health approaches today, and that is justice. As I wrote in the Harvard Public Health magazine and CABI's One Health journal earlier this year, and as a couple of colleagues and I have coming out in AMA Journal Ethics article, One Health neglects the importance of rights and justice, often preferencing traditional anthropocentric notions of public health ethics while neglecting individual agency. There have been a few authors who have talked about the importance of a human rights framework in guiding decisions about One Health, but that really hasn't gotten a lot of traction. Generally, there's not a lot of talk about social or ecological justice in the context of One Health. Starting to be more interested in ethics grounding One Health, but we're kind of at a tipping point, I think, in terms of where we'll go from here. And ultimately, within One Health, other than human animals are seen as vectors of disease, and there's very little interest in their interest. And these omissions ultimately undermine the intention behind One Health. And so this view isn't only morally problematic, it's also quite imprudent given the challenges that we face today. If we continue to focus on more proximate causes of suffering while neglecting upstream factors, including connections between rights, health, and justice, our problems are going to grow and grow. Health ultimately depends on justice, whether we're talking about pandemics or prevention, violence or peace, hunger or food security, chronic illness or wellness, pollution or a clean environment, or climate catastrophe or climate resilience. And that's why we've worked to advance a just One Health approach in which understand that humans and other animals can only be healthy if they're free to meet their self-determined physiological, physical, and mental needs, natural and healthy environments that are free of exploitation. And this approach also recognizes that the root causes of interconnected health threats to humans and other animals, including climate change and zoonotic diseases, can only be adequately resolved through policies and practices that are grounded in rights and in justice within our species and with other species. Rights are inseparable from health. And here, when I'm talking about health, I'm talking about the broad definition of health that's recognized by the World Health Organization, has been since 1948, a state of complete physical and social well-being, and not merely the absence of disease. Within medicine and public health, there's broad consensus now that physical and mental health outcomes are determined by whether or not one's rights are recognized through social, economic, legal, and political frameworks. And connections between health and human rights have really become the basis for international and domestic law, for social programs, evolving economic frameworks, and for political priorities, although I'd argue not nearly enough. And interdisciplinary action-oriented scholarship has really fueled health and human rights within medicine, public health, the law, and other fields. And that was really given a big push in 1994 with the launch of the Health and Human Rights Journal, which focuses on action-oriented scholarship in this area. And one of the first publications, seminal publication by the late physician Jonathan Mann and colleagues, including Larry Gostin, who's still working on these issues, focused on the link between health and human rights. There and other scholarship has helped to advance and also been built on human rights frameworks that reflect links between rights and health, rights such as dignity or intrinsic value, recognizing that individuals have intrinsic value, as is recognized in the Universal Declaration of Human Rights. The right to bodily liberty and bodily sovereignty, as recognized in the Convention Against Torture. The right to opportunity, positive rights, like those that are recognized in the International Covenant on Economic, Social, and Cultural Rights, and the right to equal justice, as is recognized in the Declaration of Helsinki. Sometimes we refer to these rights as inalienable rights or natural rights, but as we see with global events and as we see in our communities, not every human being has the same access to all of these rights. And vulnerable and marginalized populations, including but not limited to children, are at particular risk for not having these rights recognized. But as we struggle to achieve what we've already agreed upon in terms of international human rights frameworks, international human rights frameworks are continuing to advance. And that was recently, fairly recently shown with a UN General Assembly resolution on the human right to a clean, healthy, and sustainable environment. And this was passed in October of 2021. There's already been a fair amount of action on this. But it may not surprise you that there's no worldwide treaty governing animal rights or even animal welfare or animal protection. Some frameworks have been proposed. I know some colleagues who are working on this, but mostly it's in the context of animal welfare, while having very little attention to the connection between rights or justice and health. And despite decades of progress, literally decades of progress within human rights frameworks, we have not seen the same within governing the treatment of animals around the world. Humans, rightly so, are seen as subjects of the law, whereas animals are still seen as objects, despite everything we have learned about them in recent decades and how they can suffer and their capacities. And this is one of the reasons that we see current One Health approaches that do instrumentalize or objectify animals. So this isn't just bad for animals, it's bad for people. And so to address this gap in the literature, in 2021, we partnered with the Health and Human Rights Journal as part of a Harvard FXB consortium on health and human rights to launch a special section on ecological justice and the right to health. And in those articles, authors articulated how there is an ethical, moral, and public health imperative to move toward more inclusive frameworks that expand our community of justice to include human and other than human beings. And there are a couple of authors who really understand human rights frameworks, international justice, who contributed to open access for those of you who are in. Consortium makes it available, open access. With today's interconnected challenges, the time has really come for more inclusive frameworks that are both ethically and scientifically. And I wrote about some of these opportunities in Phoenix zones, where in writing the book, I came to understand something I really hadn't internalized before. And that is that rights such as bodily liberty and sovereignty and the opportunity to fulfill one are inseparable from physical and mental health outcomes because they are biological needs that we share with other animals by virtue of us being biological organisms. Also, the evidence also indicates that these rights are far more likely to hold up the more ubiquitous they are in society. And a failure to recognize these rights in social, economic, and legal and political frameworks ultimately trickles down to individuals and communities and society in the form of suffering. And this is structural violence. What if we were to think differently? What if we were to think in terms of structural resilience? Instead of pathologies of power and violence, what if we were to concentrate on creating social norms, legal and economic frameworks, political priorities that encourage positive changes in health, positive determinants of health? What would that mean for the way we think about priorities in research, medicine, and public health? Well, it would mean a number of things, but here's some of what we've thought about. One, we would invest much more in primary prevention, social, economic, environmental, legal, political determinants of health. That might lead to different healthcare delivery models that are focused on primary prevention and addressing determinants of health. It would lead to funding shifts such that we're more focused on upstream factors rather than downstream factors. We might focus more on economic frameworks that are based on well-being. The World Health Organization has already started to do this. There's focus on economy of health and economy of well-being. And basically what that's doing is saying, let's look beyond GDP. Let's see health as an investment and everything that determines health as an investment rather than it as an expenditure. It would also lead to more innovative educational curricula, training curricula, which we kind of already started to see in some medical schools, for example, or training programs around the nation. It would also lead to more interdisciplinary career pathways, changes in reward mechanisms. What if we didn't just think about tenure and promotion in terms of how many publications you have, but instead, what are you writing about and how does that affect society's ills? And that would also help shift research so that it's driven more by societal needs and less by commercial interests, as we now see primarily driving advances in biomedicine. There would also be more interprofessional work, more work between physicians, social workers, for example, physicians, nurses, social workers, other people within healthcare, and more cross-sectoral partnerships, medico-legal partnerships, for example. I've done a lot of medico-legal partnering in my work in conflict zones, addressing sexual violence and training a cross-sector of people who want to learn, even judges sometimes. Have also done a fair amount of cross-sectoral work in working with asylum seekers, attorneys, and law students, paired medical students, medical residents, and law students together. Then it would also lead to changes in leadership and how we conceive of leadership so that the expectation is that leaders will engage in advocacy and model effective advocacy for those who they're working with. So we've started to use some of these building blocks, if you will, to inform our strategy at Phoenix Zones Initiative, which is working to create a world of Phoenix Zones, places that advance health and well-being of people, animals, and the planet, so that society can rise and thrive like the proverbial phoenix. Lucky enough to work with local partners and global partners to reimagine social, economic, and legal frameworks. I just want to share a little bit of what we're doing in that area, using medical and public health expertise to advance it. Focus on education and outreach, innovation, and leadership and advocacy. For example, in the area of education and outreach, I don't know if you all are familiar with Project ECHO. Project ECHO was started at the University of New Mexico School of Medicine by Dr. Sanjeev Arora when he saw that his patients were coming to see him with hepatocellular carcinoma or cirrhosis because they didn't get the care that they need and the wait time was too long to see him. So he started training primary care providers in rural areas to treat Hep C so that their Hep C could be treated quicker. And he wasn't seeing a young mother who was dying of hepatocellular carcinoma when she finally got in to see him. Well, we use that model to work on interdisciplinary education, training, and mentorship that's focused on just One Health so that people can bring their cases, their local problems, whether it's violence in the community or disease risk or environmental degradation and access to green space, and we problem solve together using at Model. We also offer cross-sectoral internships and externships, including for folks in medicine and the law, for example, offer events, expert panels, and webinars free to the public, as well as publications and public and for professionals. And in the area of research and innovation, we publish research and editorials on a number of the topics I've spoken about. We offer technical expertise to other nonprofit organizations using our medical and public health backgrounds, also work with corporations who are interested in advancing policies and practices that benefit people, animals, in our shared environments. And then recently we were recognized for special consultative status with the UN Economic and Social Council, and we've been able to provide counsel to UN member states and UN bodies, as well as others in the UN. We also, like WHO, are interested in modern economic tools that go beyond GDP and instead look at health and well-being and a number of determinants of health. Then finally, we've partnered with George Washington University and their law program to look back at the principles, including justice, that are articulated in the Belmont Report, which governs human research in large part, to think about what do those principles mean in 2023, not only for human beings, but also for non-human beings. Then we also work on global policy with partners. We're working to influence a pandemic treaty on prevention and response that the WHO is negotiating. This would be the second ever WHO negotiated treaty. The first been, the Framework Convention on Tobacco Control, which has had a tremendous influence. We want to see that determinants of health, including connections between people, animals, and the planet, are recognized in any WHO negotiated treaty. And finally, we work on national and local policy, including model legislation that addresses determinants of health and research ethics with members of Congress in the Senate and the House, and we're working on that now. And for any of you who are interested, as part of our free resources, we have a toolkit on effective advocacy for anyone who's interested in engaging in effective advocacy for their behalf of. Just some final parting thoughts, if you will, maybe some lessons from the coronavirus pandemic. Clearly, we are all connected in ways that we recognize and in ways that are really invisible. And we can change, much like the virus has changed. But to do that, we need to consider the deepest roots of our problems that ail individuals, families, communities, and our society. And we need to consider holistic approaches that really tend to the problems that we're facing today. And we should always be striving for solutions that are ethically and morally.
Great, thank you for such a powerful presentation. And we're going to turn now to have more of a conversation. And I would just ask that for folks in the room to please press and hold the microphone when you have a question to ask. That way we can be sure that the folks on Zoom can hear the question. People on Zoom, please do chat your questions in. We'll be curating those and bringing those in. So to have a bit of a conversation, maybe to get us started, I love the idea of just one health because it provides this moral backbone motivation to the concept. I suspect some people might wonder, well, does this mean that we have to all agree on what justice is? So could you comment on the extent to which you think we have to have agreement around principles of justice or even human rights, or is some agreement enough? Any thoughts on that question?
I think starting with some agreement and just the idea that principles matter, and that we should be striving to define what those principles mean, including for the times and situations that we're working in, and then articulating basically what it obligates us to in one way or another, I think is a really great first start because I think one of the challenges, even with One Health, is that there's this framework that has a lot of substance behind it. But if it's not grounded in some type of principles, it's hard to know how to make trade-offs, for example. And so we need some guiding principles, including that of justice, that I think more and more people are getting interested in generally. And then I think we're seeing more and more discussion of justice within healthcare, within medicine, research, public health, and other fields.
Great, thanks. Now, a question from the audience here.
Oh.
Yeah, just press and hold if you don't mind. Keep it down.
Thank you. Thank you for presenting today. And I appreciate that we're all interconnected more than we often appreciate. At the human level, there are, concepts like our Hippocratic Oath and how we interact with each other. And I know a lot of physicians kind of feel that over the past, with some of these other structural changes that have happened over the past 20 plus years, they've had their Hippocratic Oath removed. I mean, might that be considered a part of a human right because it's how we interact with each other? And I guess part two is really, does justice include just how we interact at that human level?
So I mentioned ancient and indigenous traditional knowledge is underlying One Health. And part of that is Hippocrates and his writings. Although if you dive into Hippocrates' writings, there are many problems with many isms in terms of how he articulated his own beliefs or understanding of the world. But today, of course, we have a Hippocratic Oath that's really evolved to focus on this idea of non-maleficence, or trying to avoid harm in as much as we can, while also exercising justice in as much as we can. And I think that that's a great starting point. And you mentioned people becoming demoralized. I think part of the reason is because we're being asked to focus on so many other issues, like including the commercialization of healthcare, rather than the principles that brought many of us to medicine in the first place. And so I think that's absolutely a key part of it. And I think it's a great starting point, and how we as physicians can also share with our veterinary colleagues and other colleagues who maybe don't have as much grounding in that type of ethic, but are clearly interested in it, because colleagues, for example, in vet med have borrowed papers that colleagues and I have written on the subject of justice and non-maleficence. And so there's interest. I think there's interest across fields. And remind me of your second question.
It was just pertaining at justice. I mean, I'm just thinking as the human interaction level, is that part of the definition of justice too?
To me, it certainly is, especially if we're thinking about social justice and how we recognize each other's rights. In thinking about dignity, for example, I think this has to do a lot with whether or not we see each other, respect for dignity. And, I just think about, even, there's been a lot of attention to homelessness here in the Denver area in recent years. And I was articulating to a colleague just a few weeks ago about how people aren't seen. We're not seeing each other, and we're especially not seeing those who have struggled with different forms of marginalization. And so I think that justice, for me, justice is the relationship between other rights, whether or not we recognize dignity in each other, whether or not we recognize each other's bodily sovereignty and bodily liberty. And I think it starts with seeing, that word respect, to see.
It's interesting to look back and see hints of One Health in these prior writings and documents and so on. Do you have thoughts as to why we forgot about it for a while and why it's coming back now?
So I think that I'll answer the latter part of your question first. I think that there's an urgency now. I mean, we see that with pandemics and climate change, we can't neglect these connections between people, animals, and the planet. And so I think that that's part of it. And I think crisis sometimes invite opportunities. I think about that with our patients, right? After they have a heart attack, that's one of the best times to intervene in terms of tobacco cessation or something. After a region of the world or a community goes through a disaster, that's one of the best times to build a healthcare system. And so I kind of see the same thing with One Health. Like, okay, there's these crises and people jumping in who understand One Health. Here's an opportunity, so I think that's part of it. And then I think we as humans are easily distracted. And, we're easily distracted from principles. We're easily distracted from these basic ways of how we should be treating each other. And so, maybe that's one of the reasons that these ideas fall by the wayside. But if we allow them to ground us in concrete ways every day, in the way that we practice institutionally and interdisciplinarily and in our departments and in our everyday lives, I think they just, by virtue of us practicing they become more embedded in us, if that makes sense. We have to be intentional about some of it.
There are questions here in the audience or perhaps on the chat? There aren't questions, maybe to ask you a bit more about some of those practical actions. Like what do you see? I know you talk a lot with students and trainees and others. What are those conversations like? What do you see in trainees in the future? What practical actions could students be taking?
So I'm really encouraged by every generation of students that comes along. I have, it could be that we find each other, so there could be a bias there. But at University of New Mexico School of Medicine, and when I was at GW and Georgetown, DC, kind of everywhere I go, I see these learners who are genuinely interested in the practice of justice. And, it's been written about as calls from below in terms of what they want to see in their curricula. And I think we as faculty really need to respond to that. I have some residents now who want to build in determinants of health and more social medicine into their training. And so, we're talking with them about how we can do that in ways that, meet curricular requirements and meet their needs and interests at the same time. And I think we have to seize that opportunity as faculty, because they're going to go out and practice and do whatever they do, in just a few short years. And if we can do whatever we can to support those interests now, I mean, I see it come back. I have medical students and residents, for example, in a bunch of different parts of the US now, because, everybody spreads out, who now are leading human rights clinics, and so just a little bit of mentorship can go such a long way. And just also supporting them, those who have those interests, to know they aren't alone, that they, there's a reason that they have an interest in that, and it's supported.
And what about the animal component? I wonder about that. Seems like a whole nother step especially for something like a medical school to be considering animal rights, or thoughts on that?
Yeah. So this is another area where I see intergenerational change. And as they're coming up and they're asking questions about justice, okay, who does justice include? And so I see younger and younger generations really taking an interest in this, and they do it in different ways. They exercise it in different ways, whether it's through One Health type clubs, or thinking about the relationship between human rights and animal rights and that sort of thing. But I think it's younger, it's younger than health and human rights is. And I think this might be a little optimistic, but I think that will grow in the next 5, 10 plus years.
It seems like it will have to, just as we start to think about climate change and the environment. That seems like another way into having some of those conversations. I think there may be a question in the chat.
There is, and I'm glad you asked the animal question, because I was going to ask something similar. A nice segue from the question about students. We actually have a younger professional in the chat, Kimberlyn. As a young MPH with aspirations to join the field as an MD soon, how do you advise placing these important concepts at the forefront of our attention when the commercialization of healthcare is such a huge factor? I fear I will be joining a field with the hope of being an intentional, trauma-informed, equitable physician, but will be frustrated by the business-like barriers to practicing compassionate medicine.
So I think it's such a important question and such a big question. And I think, I've seen positive changes in educational curricula over the years. I don't know if you've seen the same, but I see curricula getting better and better and more responsive to, to the problems that we face as a society. And I think one of the key things for people who are considering or planning to go into medicine is finding the right fit in terms of programs. So, not every program is the same in terms of the curricula that they offer. And so finding that, same with residency training. There are some residency programs that focus more on social medicine, for example. And so I think that's really key. And then once you get to medical school, wherever that may be, I think finding other people who are working toward the same objectives is also really key as well. And like I said, I think more and more of those opportunities are becoming available around the country based on what I've seen in terms of different curricula in different places.
I agree. Are there questions in the audience?
Thank you so much for your talk. And I appreciate your emphasis on upstream strategies and the need for those as a public health scientist myself. And I'm curious, though, what your thoughts are, because in practice, I feel like the public health field and workforce is very disconnected from clinical care. And it seems like we need to come a little closer. I don't know if you see changes in that happening. I hear the medical student online talking about their interest in it. So I'm hopeful, but it feels like once we leave these academic halls, the reality is public health is on its heels, funding wise, workforce wise, especially after COVID. But public health is also a field that's is critical to trying to implement any sort of upstream work. Do you see a new attention being given to this from clinical practitioners?
So I think among some, yes. And I think there's maybe a difference in terms of which fields people are going into, but I do see it even across fields from time to time, kind of going beyond primary care, for example. So, certainly as there's interest in medical homes and the understanding that we need for interdisciplinary work with our colleagues in public health and social work and law and so forth, there, certainly see that it can happen and does happen. I think we, as professionals, need to exercise leadership to lobby for those funds and to show their importance and why they make a difference to people who are making the decisions about funding and to the communities that they're supposed to be representing. So that's part of where I think we need to be more engaged in advocacy. Give ourselves one more thing to do, but we can tell the stories without violating the privacy of the care of or working on behalf of. We can tell stories that really bring home those social, economic, environmental, legal, and political determinants of health and what they mean to those individuals, to their families, to our communities, and society more broadly. But it's a that I think we just always have to be an active participant in.
You just mentioned communities a couple of times, and you didn't talk about it a lot in your presentation, but I'm sure you have views about the role of community engagement and empowerment in the One Health movement. Any thoughts on that topic?
Particularly in One Health, I'd like to see a lot more there in terms of community engagement and empowerment and that sort of thing. And so sometimes when I talk about effective advocacy, I talk about how important it is to engage in engagement, community participation, and to think about horizontal versus vertical approaches, right? So especially when we're doing community engagement, we need to take more horizontal approaches where we're actually letting members of the community identify the problems that they face and the solutions that they've thought of, because oftentimes they have better solutions than we do. And I think what we can do is we can bring a theoretical construct, right? And kind of help communities work through that and help navigate systems, they might not be as empowered to address, but if we think about that more in terms of partnership instead of these top-down vertical approaches, my experience at least has been that those are the more successful approaches all around.
Agree. I'm going to pause for a minute for questions in the audience.
Thank you so much for being here. I believe that in addition to all these systemic changes, I think each of us has in the dominant culture who have contributed to climate change, but have not experienced the impacts. I think each of us on a personal level have like a reckoning or I think process of healing to go through where we can see how we've been personally complicit, either through like, for example, the voting with our dollar as consumers and contributing to the suffering of animals through factory farming, things like that. I wanted to ask you what advice you have for navigating that difficult work on the individual level that I think is, for me personally, is from that point where I can actually do the best advocacy work.
The things that I learned and I was really surprised by in working with individuals, human and non-human individuals, who overcome suffering is this capacity for resilience. And we often talk a lot about vicarious trauma, right? And compassion fatigue and that sort of thing. But what I realized was this capacity for vicarious resilience. And I actually think that's what I've benefited from the most during my career, is experiencing a vicarious resilience through individuals I've come to know in these different spaces when they are given a chance. And I think, thinking about those individual choices and that reckoning that we have to face in terms of building resilience is perhaps one of the ways to think about it, so that every choice we make becomes another step toward that resilience, not only for ourselves, but for the other human and non-human beings we share our lives with, directly or indirectly.
One other question, and then we'll go to the chat.
Think I'm working this right. Cool. So I graduated about 2 years ago and spent some time at the Capitol working for the Speaker of the House, Alec Garnett, and was, as just like a young person too, was just deeply disappointed in how a lot of these bills, and I guess just surrounding human rights, specifically the fentanyl bill, it was back in 2022. I guess just like that fine line between, or I guess the barrier between representatives asking advocates what they think should be included in the bill. And I guess just like my question is, what is your stance, or what do you think the best approach is to eliminating that boundary between individuals who are in the ground or like on the ground doing the work versus representatives who are actually putting that into word? And I feel like that's just been like a huge issue both on the federal and state level as well.
So, well, number one, think about running for office, right? Because we need more people who actually have experience on the ground in office, and I think bridging that gap in as much as we can is really key. There's some practical considerations we have to think about, like how much money is in politics and how politics works and all of those things. But, there is evidence on how we can effectively organize, and how we can effectively mobilize. That's part of what we have in our effective advocacy toolkit that's available. And part of that is storytelling and, getting the right people at the table and that sort of thing, as well as a number of other ways to mobilize and organize engagement with the media, that kind of thing. But there's a science to this now, and I think the more deliberate we are, about how we try to affect change and thinking about things strategically, the greater our likelihood of success. But overall, I think we need to be bridging the gap between how we think of who holds power, right, and wields power, and who's influencing, those pathologies of power that we should, kind of flip on their back.
I think there was a chat question.
Question from the chat is sort of a broader look at the question that was just asked. This is from Christopher. He says, thank you for the great talk about an important topic. What kinds of policies are you advocating for in the legal and legislative realm?
Repeat that one more time. I'm sorry.
From Christopher, what kinds of policies are you advocating for in the legal and legislative realm?
We advocate for a number of things from kind of a local to national to global level. Nationally, we especially focus on research ethics, for example. And right now we have model legislation that we're working with staffers and on both sides in the Congress. And there we're really pushing for the agencies within the Department of Health and Human Services to even take a look at how research funding decisions are being made based on attention to primary prevention, social, economic, environmental, and other determinants of health. And then also thinking about how research ethics is really operationalized within funding mechanisms and that kind of thing. That's one of the big things that we're working on now. Internationally, we work on things like the Sustainable Development Goals, which are built on human rights frameworks, but don't really operationalize that way. And we're focusing on attention to the connections between people, animals, and the planet in terms of sustainable development. And then also on the Pandemic Prevention and Response Treaty, as well as climate change and climate policy, and a number of other things that are active on the international stage right now, especially within UN bodies. And there, I just have to say, I think some of this can sound very bureaucratic at times, but what I've been encouraged to see is that civil society organizations are actually the way that change happens, including at the UN level. And I think the same thing holds true nationally and statewide and more locally.
As we get toward time, maybe just one final question. Fast forwarding to the future, you come back and visit with us in 5 years. What's different? What do you see?
So, I think we have to think about multiple levels, structurally, because that's how things change. And so I think changes in education curricula, changes in training and the way that we train our emerging health professionals. I think that's a key part of it. Changes in pipelines, how people design their careers and in interdisciplinary ways, changes in engaging with the communities that we say that we serve, shifts more toward primary prevention, I think, but we have to push for that to happen. Right now, even like during the pandemic, for example, at my institution, there's been this huge investment in intensive care units, which is necessary, right? But that's not addressing the upstream factors. And I would love to see us investing more in upstream factors.
Well, I think as we get close to time, I'm going to thank our in-person and our Zoom participants. Please do be on the lookout for a post-event survey. We do appreciate your feedback, and then join me in thanking Dr. Ferdowsian for spending time with us today.
Yeah, yeah.